Hi Dr. Jed, nice to see you again. Nice to see you too. Today I'll be talking about antivirals. To let you know, I would not be talking about COVID-19 drugs as they are still a very new field of medicine at the frontiers of science. But what I can talk to you in detail are about antiviral drugs that have been around for quite some time, that enough science has been done to investigate the drug. Just as a starter question, what do you think antivirals do in general? Other antivirals, given by the name, can be divided into its root word and prefix, anti and virals. Doesn't this refer to drugs that inactivate viruses? I mean, viruses cannot necessarily be killed because they do not have the 7 characteristics of living things, right? Nice for your knowledge, young boy. Can you tell me some antivirals you're aware of? Maybe about 3 antivirals you're aware of? Inosine, pranobex, oseltamivir, and aciclovir. These are 3 antivirals, right? Yeah, wow, you've really done your research today, young boy. Seems like you're very interested in medication and drug, eh? Yes, I thought it would be great to demonstrate some great awareness in pharmacology if I wanted to become a doctor in the future. It's always great to know about pharmacology and common drugs, whether you are interested in taking medicine as your career choice or to enrich your general knowledge about science and the world. And you haven't exactly gone to the wrong place here. Now, why don't I teach you a bit about aciclovir, oseltamivir, and inosine pranobex? Can you? Thank you very much. So let's start with aciclovir. Aciclovir is active against HSV1 and HSV2 viruses, which is herpes simplex virus, as well as the varicella zoster virus, which causes chickenpox. So it can treat viral herpes and chickenpox. Aciclovir works against herpes simplex virus through the intracellular conversion of aciclovir by viral thymidine kinase to the monophosphate with conversion to the diphosphate and the active triphosphate subsequently. This active form then inhibits the HSV-specific DNA polymerase enzyme, as well as being incorporated into the viral DNA. Because of this, it does not affect the cell's own function, but only affects the viral DNA or RNA that's being targeted. Oh, I see. By the way, is there such a thing called resistance in antiviral medications? Yes, there's such a thing called resistance in antivirals. Now, connecting to the topic of aciclovir, the resistance of aciclovir is due to the altered specificity of the thymidine kinase's active site, which is an enzyme, as well as certain HSV viral mutations and reduced sensitivity of viral DNA polymerase. Wow, that's very interesting, Dr. Jen. Now, many drugs have precautions, right? Yes, if not all drugs have precautions to them. If you're asking about the precautions of aciclovir, those who are hypersensitive or have allergy-like symptoms, reactions to aciclovir should not take aciclovir. It's quite logical, right? Then the immunocompromised, women who are breastfeeding or pregnant, children, and those with renal impairment should also take aciclovir under those changes and probably special precautions. Thanks for answering the question I was just about to ask a few minutes before. Following up with that, if I were to take aciclovir orally to treat my herpes infection, what side effects could I possibly feel? Good question. The thing is, you won't feel all the side effects, and sometimes you won't feel any side effects. The following side effects I will list are just possible side effects. Okay. So some side effects include gastrointestinal disturbances and discomfort, like vomiting and nausea, and diarrhea maybe? Yes, very good. You're correct. Also, the side effects of aciclovir may include headaches and dizziness. Dizziness and headaches indeed can cause nausea too, which then could make you vomit, which, as you know, feels like your stomach is not well. But sometimes these side effects might not be symptomatic, or may just be mild. The severity depends on the person. Now, many drugs also have side effects if a person accidentally or purposely overdose themselves on it. Now, what symptoms can a person feel if they're overdosed, whether accidental or intentional, on aciclovir? Some people may feel confused and delirious. Some people feel nauseous to the point of vomiting, and some may feel headaches. These are relatively mild side effects of overdosage and overdose, and it can also cause serious consequences sometimes. So it is important that you better follow your doctor's instruction about how you should take the drug and its prescribed dose. Thanks a lot for your explanation. Shall we now move on to talking about oseltamivir? I've heard a lot about it during the flu season. Yes, oseltamivir is one of the antiviral medication for flu, which is scientifically known as influenza. Following on, oseltamivir is used and commonly used to treat influenza A and B viruses. Influenza A viruses are more prevalent than influenza B viruses, by the way. When you take it in the form of tablet or capsules through the mouth, it's usually given in the form of phosphate, so it's oseltamivir phosphate. It may be taken with or without food, but taking it with food may be used if you have gastrointestinal discomfort. Speaking of which, vomiting, gastrointestinal distress, headaches, and cough are some of the examples of side effects people may feel after taking oseltamivir, but these side effects are hard to distinguish with the actual symptoms of influenza or flu, as cough and headaches are also symptoms of influenza. I see. Well, how does it work though? Does it work similarly to aciclovir? Well, it does not work exactly like aciclovir because they are different drugs. But what I can say is how oseltamivir works. Oseltamivir's active metabolite after metabolism is oseltacarboxylate. It selectively blocks the viral surface of neuraminidase, an enzyme found in influenza A and B viruses. This prevents the release of virus particles from infected cells. Resistance is generally caused by viral DNA mutations. Any special precautions or contraindications to oseltamivir, like who should take it and who should not? And does it need to be taken with special monitoring or altered doses? Again, those who are hypersensitive or have allergy-like reactions should not take oseltamivir. Basically, those hypersensitive to a drug should not take that drug because these reactions can be life-threatening, like anaphylaxis. As oseltamivir can enter breastfeeding mothers should take it with care. Pregnant women and those having ongoing respiratory diseases should also take it with special considerations and monitoring. Cool. Now, how about we move on to discussing inosine pranobex? Sure, what about it? Well, as an introduction, inosine pranobex can be used to treat herpes and genital warts. It treats them by stimulating T lymphocytes, which are like white blood cells, and macrophage cell functions, and influencing the production of cytokine, which normalizes the body's dysfunctional cell-mediated immunity. Now, if I were to take it, what kind of side effects could I feel? You can experience some nausea and vomiting when taking inosine pranobex. Those with impaired renal function, kidney stones, gout, or high uric acid concentrations in the blood should exercise caution when taking it. And is that it? Yes. Thank you so much for your time, Dr. Jet. See you next week. You betcha.